So, Stephanie, one problem a lot of people have, and I'm sure they're wondering, what causes bad breath?
Interesting question. So, bad breath can be a result of poor oral hygiene, so not removing the plaque that builds up on our teeth. Um, However, bad breath can also be due to a possible underlying health condition. It could be caused from the presence of gum disease or tooth decay. And sometimes we see bad breath occur from the use of medications. If you have bad breath that cannot be resolved by taking care of your proper oral and participating in proper oral hygiene methods, then it's best to reach out to your dental provider and see if anything else might be going on.
Okay, so solve the debate. What is better? Should we be using an electric toothbrush or is a manual toothbrush fine?
Studies reveal that an electric toothbrush might just do a better job with removing plaque. And this is because the electric toothbrushes either rotate or vibrate the bristles, which can help with removing the plaque that builds up and causes other issues. Some electric toothbrushes even provide a little signal that might go off if we apply too much pressure with the toothbrush. And interestingly, many of us tend to apply too much pressure and brush a little too hard. And this is an issue because if we brush too hard, then we can see the gums start to recede. So having that additional feature on the electric toothbrush might be helpful in preventing other problems.
So, if I am one of those people that has dentures and I don't have any teeth, do I still need to see my dentist?
Even if you do not have any teeth, dental appointments are still necessary. And this is because one of the parts of the dental appointment is the oral examination, in which the dental provider examines not only the teeth, but also the soft tissues in the mouth
Mm.
for other signs or symptoms of underlying diseases, such as oral cancer. Having a regular oral exam is imperative, even when we don't have teeth.
So it sounds then like my oral health really does have a strong relation to my overall health.
Mhm. Yeah, many are unaware of this relationship. Many people don't know that the health of the mouth can pose a risk to the health of the entire body. For instance, studies have shown a relationship between gum disease and diabetes, as well
Oh,
as cardiovascular disease. In addition, many medications, especially prescription medications, have a side effect of dry mouth. And when dry mouth is present, when we don't have that saliva to neutralize and keep the mouth moist, it dramatically increases one's risk for tooth decay.
okay. So, in the knowledge that we're dealing with COVID-19, and some people may be a little apprehensive perhaps about visiting their dental office, what will a dental appointment look like during COVID-19?
This probably depends on the location of the office or clinic, as well as some of the key characteristics of the office and clinic. For example, the ventilation of the building plays a role in what procedures can and cannot be carried out. And this might change week to week, for example. The guidelines are constantly changing as far as what is the best way to handle the dental appointment. In many cases, though, we can see a limited amount of appointment spots per day that could be available. We might also see the patients being distanced at least 6 feet apart. Patients might need to complete a screening questionnaire, and temperature checks might be required as well.
So, what should I do when I go to my dental office to make sure that all COVID-19 precautions are being met?
Again, of course, this depends on the office location and the office that you attend. But if you have any concerns, you might choose to call the dental provider or the office prior to your appointment, just to see what precautions are being taken, and how they are handling managing around working with the COVID-19 pandemic. You might call and ask about if patients are allowed in the waiting room, or how many patients are allowed in the waiting room at a time, where the patients are being seen in the office, if they are distanced, or maybe if the staff are being tested or screened regularly.
Okay. So what makes HAP dental coverage stand out from other carriers? I can tell you that at HAP, we know that dental and oral health is important for your overall health. We partner with Delta Dental to offer our Medicare and Medicaid member options. For Medicare members, we've improved our preventive dental coverage in our 2021 individual Medicare Advantage plans. We offer 2 cleanings, 2 exams, and a set of bite wing x-rays. Also, if a member is a snowbird, we have dental benefits that travel with them. So our members don't have to worry about scheduling their dental visits around their travel. We've also expanded optional dental offerings to 3 package levels. We have basic, value, and premium. And this additional level of dental for purchase offers other coverage, other services like fillings and crowns and such. For our Medicaid population, our HAP empowered Medicaid members also have dental coverage as part of their coverage. Our Healthy Michigan plan members have benefits including dental exams, cleanings, and extractions. They even have coverage for fillings and x-rays. We also know that good dental health for expecting mothers is important, not only for their health, but also for the babies. HAP empowered pregnant moms have covered dental services through 3 months after their due date. All children with Medicaid coverage also have dental coverage through Healthy Kids Dental. We know the importance of starting good health habits begins with taking the fear out of a dental checkup. That's why we encourage parents to schedule a dental visit early on in their child's life. You can call HAP or check our website to find the dentist that's closest to you. Stefanie, at what age should a child begin seeing the dentist, and how often should we take them?
The American Academy of Pediatric Dentistry actually recommends that a child go to the dentist by age 1 or within 6 months after their first tooth erupts. Typically, at this visit, the dental hygienist or the dentist examines the child's oral cavity to make sure all the teeth that are supposed to be erupting in the mouth are right on time and as predicted. The dental hygienist or dentist might also look to see if there are any other risks for the child experiencing tooth decay or any signs of early tooth decay. Overall, this first visit is really an educational visit to make sure all the necessary precautions are taken to prevent unnecessary decay from occurring. And the child should go to the dentist twice a year.
So is that true for all of us? Do all of us really need 2 visits per year? Is that best?
This is actually dependent on the individual. So, some of us might benefit from going to the dentist up to 4 times per year, every 3 or 4 months, whereas others who maintain their oral health might only need a yearly visit to keep everything stable and healthy.
Okay. Well, Stefanie, thank you so much for spending some time with us today. We really appreciate your insight on the best way to keep our members and their teeth healthy and clean. For those of you watching, thank you for joining us today. We will post a recording of this town hall on our Facebook, Twitter, LinkedIn, and YouTube channels. Please like and share this video and help your friends and family members stay informed. You can also subscribe to our HAP Facebook page and visit our website at www.hap.org/blog for the latest tips on health and wellness during this time. One final thought before we sign off: please stay safe and remember, HAP is here for you.